Reader in Infectious Diseases at Cardiff University, also the head of department at its School of Medicine. Andrew, thank you for joining us. What is uppermost in your mind as cases? We could talk about India, Brazil, the United States, wherever you wish. Numbers are going up, Mexico as well, but we're concentrating on Europe. What's uppermost in your mind as Europe records this rise, significant in new infections?
Yeah, well, it's very concerning, and we are seeing it really, I think, the beginnings of an exponential rise in cases. Certainly here in the UK, it's estimated about 6,000 cases a day, but the government's chief medical and scientific advisors suggested it might rise to as high as 50,000 by mid-October. So clearly very concerning.
Does the world of medicine know enough now to be able to significantly lower the mortality rate of those in intensive care units?
Well, we know more, and we've got some treatments that work. We don't yet have a magic bullet to treat this infection, but I think that we're significantly better prepared now if we do see more admissions to hospital and more cases requiring intensive care, that we should see better outcomes.
Which of the therapeutics do you think they're possibly providing the best solution in terms of lowering that mortality rate?
Well, I think really it's only steroids at the moment that have been shown to be significantly beneficial. They won't prevent all deaths, but they certainly reduce the mortality rate. They perhaps save about 1 in 5 deaths. We're getting better at knowing which patients do and which patients don't require mechanical ventilation. There is this drug remdesivir as well, which has some activity, but probably fairly marginal. So I think we definitely do need more therapeutics.
Yeah, you could say that actually you or someone in your profession could have given that same answer about dexamethasone or remdesivir a couple of months ago. So maybe we haven't moved as far as we would have hoped. But what about the concerns for those, at least, who live in the Northern Hemisphere about what might happen this winter? What are your thoughts on that?
Yes, well, we were expecting a difficult winter. Certainly in the UK, it's always difficult in winter with respiratory infections of various different kinds, obviously flu. And so COVID on top of that is going to create huge problems. We're anticipating that and making preparations, but I don't think there's any doubt that we're going to have a difficult winter.
What would your advice be to people who are spending more times indoors? I know in many countries, a lot of the significant rise in numbers is happening due to infections that are passed within households. So what kind of advice do people need in winter months?
So, I mean, that obviously is the case, and people will spend more time indoors, obviously, in winter months. What I think we may see happening is more national measures being brought in. We've just recently had the introduction of the rule of 6, so that no more than 6 people from, if it involves different households, can meet either indoors or outdoors. But clearly for people living in the same household, I think it's very difficult to avoid a spread of infection, other than, of course, the basic hygiene measures, washing hands frequently.
Andrew, do you support localized lockdowns over national lockdowns? A lot of people who have studied the spread of this disease say that localized lockdowns are really only a way of slowing down the spread of the disease, and national lockdowns are the way to significantly reduce the numbers.
Well, we've been having a series of local lockdowns for the past month or two, which have, I think, worked to some extent. But we are now seeing more generalized spread of the infection really throughout the UK, and that's being seen in other European countries as well. So I think we are going to need to have additional national measures, but hopefully short of a full lockdown, short of the measures that we saw at the peak in April.
Andrew, thank you so much indeed for taking time to speak to us. I can't imagine how busy you are in these days of the coronavirus. Really appreciate it. Andrew Freedman from the University of Cardiff.